You know, everybody hears about cancer, you hear heart disease, heart attacks, but you never hear about Marfan's and you never hear about aortic disease.
I was at the gym that morning. You know, I was at the gym on the treadmill, running. I was going through my life, you know, as if nothing was wrong.
I woke up in the morning and was having a normal day and went to make coffee and all of a sudden had a shooting pain that went up my shoulder and completely down my back. Long story short, I was brought to Hackensack University Hospital where they did a CT scan and found out that I was having an aortic dissection.
Got my annual echo, and about 5 or 10 minutes into the echo, the lights popped on and my cardiologist, Dr. Stern, walked in and said, "There's something that looks off. There's a potential that you're gonna have to have surgery."
Kidneys failed, liver failure, lungs were not working, dialysis machine was not working because he was developing blood clots. Anything you can think of to go wrong was happening to Sinclair, and we were kind of in the dark. We really didn't know anything about it. It was very scary.
My brother, who is a physician who also has Marfan's, sat at my bedside looking up medical journals of complex aortic repairs, and he started to notice that all of the journals that he was reading were written by Dr. Coselli. And my brother, while I was in the hospital, called Dr. Coselli, and Dr. Coselli called back right away. And when my brother asked if there was any way possible, if Dr. Coselli would be my doctor, and he gladly agreed and said he'd love to have me as his patient.
I've been honored to have operated upon some 6,000, 7,000 patients with aortic pathology.
It was a very, very rough recovery. You know, we had to learn to eat, to swallow, to talk, to walk. Now you would never know that he went through any of this.
I felt like I needed to get involved, you know, to help, you know, raise awareness, you know, raise money for a cure, for research, and my surgeon pointed me to the Marfan Foundation.
It's a really good place to get information. It's where, you know, we go to find out what's happening with research, treatment plans, but going to the events and meeting other people and speaking to the foundation, you realize that there are a lot of other people, and there is, you know, there are things being done.
I know how important this foundation is, and if there is something that I can do, and they felt I was able to, you know, bring more awareness and bring more attention to the foundation, I'm more than happy to do it.
I do not believe that the progress which has been made in Marfan syndrome and related conditions would have ever taken place without the Marfan Foundation having become intricately involved at almost every level. Being honored at the gala of this award is off the charts. I've had what I hope is a reasonably successful career and a few honors along the way, but probably nothing of the magnitude of this.
Because of him, I'm here today. I was able to go back to work within 5 or 6 months, and if my family didn't spend the time to do the research and find Dr. Coselli, I don't know that that truly would be the case today.
There's, you know, personal vested interest. You know, as both my 6 and 2-year-old sons have this disease, and they're going to be on medication their whole life, and they're going to be impacted, and they're going to have to be, you know, restricted. If there's a better lifestyle for them in 10 years, I'm going to keep doing it and working at this, you know, as much as I can.